So I'm at the VA. I'm a laser expert on salary in a closed medical system. So I'm actually agnostic on medical versus laser therapy. So, I think there's an argument for both. I was wondering who gets to claim photodynamic therapy because you have medical and light-based. And one debate I'd like to resolve right now is non-ablative or non-ablative, hyphen or no hyphen. We're going to show of hands with the hyphen. Okay, it's about half, I guess. All right, it'll go unresolved today. So the answer is that the choice depends. So we're talking about temporary, long-term, mild or moderate acne, moderate, severe. Are you trying to mitigate both active acne and scarring from previous acne? How easy is it? How many trips to the clinic? What's the appointment frequency? How painful is it for the patient? Do they have a medical history, psychiatric or other issues that preclude systemic therapies? What's the cost of care? So what's good for the practice might not be great for the patient if they're paying out of pocket. So certainly there's some patients who would love to get on this treatment. Will insurance cover it? And my attitude on devices for the acne is informed by my experience with scars. So we have a bunch of treatments for fractional lasers, for example, that are life-changing for patients. We have 15 years of experience, and yet insurance reimbursement is still spotty. And I'm afraid that the same thing is going to happen where we don't have lasers that are approved for acne. Does that sound still okay?
Perfect.
So I went to the literature to try to inform this talk. And actually some guidelines just came out from the AED. These are in press. So the gist is that the available evidence is insufficient to develop recommendations. So they don't really appear in the guidelines currently. We have an FDA-approved device, but the evidence was not evaluated with randomized controlled trials, so no recommendation there either. Team Eichenfield did a review back in 2021 in JAMA, not JAMA Derm, but the real, JAMA. And let's see if we can see laser recommendations in there. Well, they don't appear for mild, moderate, or severe acne. So it's a little premature. Medical therapy remains the gold standard in the literature. We're lacking large, multi-center, double-blinded controlled trials. Photodynamic therapy has the most supporting evidence. Not FDA approved, and Dr. Sakamoto was coming from Massachusetts. I pulled one of the guiding documents from Blue Cross Blue Shield, and it's still considered investigational. They're not going to cover this. And recent large reviews and treatment guidelines lack explicit recommendations for laser therapy. So there was an article, how about cost effectiveness? I found an article out of the National Health Service in UK, and which is similar, I guess, in some sense to the VA. The caveat is they only evaluated photochemical, which is just shining light, or red or blue light on it, or photodynamic therapy. They did not evaluate lasers. So for mild to moderate acne, photochemical therapy did appear to be cost effective. PDT for moderate and severe was effective, but not cost effective in their analysis. We came out with a consensus paper back in 2022. A lot of big names from the society were on it, and pertaining to the treatment of acne scarring in devices. So what I've highlighted here is that a large majority advocated parallel treatment. So synergistic effects between systemic therapy, traditional systemic therapy, and laser treatment for inflammatory acne. In addition, the majority advocated energy-based devices in the context of isotretinoin. So either concurrently or beginning within a year. And I'll point to some ancient papers. This two consensus papers came out about the same time as our book, Andrew, back in 2017. But if you are still hesitant to integrate devices into your treatment of acne scarring within a year or while patients are on isotretinoin, you have two consensus papers backing you up to start less invasive treatments for acne scarring because it might be more effective early and patients may suffer less with the consequences of the acne scarring. And this ASDS Guidelines Task Force said basically the same thing. So favoring less invasive devices would not use fully ablative resurfacing in the context of isotretinoin. However, non-ablative lasers and other vascular lasers, you probably have a good standing. So take-home points. The best treatment for acne scarring is acne treatment and prevention. Topical retinoids and medical therapy can treat acne scarring that's mild. While current laser therapy is promising, medical therapy remains the evidence-based gold standard. And lasers are a gold standard for acne scarring, and expert consensus and literature support early intervention with less invasive devices. Patients are often best served with a combination of medical and procedural therapy.